Welcome to another episode of the HealthCast. I'm super excited today to have Yaara Nussinovich. She's the co-founder and COO of Maitri app. Welcome, Yaara.
Hi, Val. Thanks for having me today.
Thanks for joining us. I was really excited to sit down with you. How about I let you take over and just jump right to it? Why don't you just give a brief overview of what your app is all about?
Yeah, absolutely. So I think I'll start with a name just because it's probably not so much common place. Maitri is a Sanskrit word. It means loving kindness and kind of like heartfelt compassion for yourself and for your fellow man. And we felt it was very appropriate for what we were building and the kind of change or impact that we wanted to have on communities and societies and people who are patients.
Myself working in healthcare, I feel one of the things that it gives me some peace of mind because I feel like the world, especially maybe every generation has thought this, but things feel a little off kilter, maybe a little crazy at times. And when I see people doing good work, or when I think about my role is to try to help impact someone's day, it gives me some peace of mind. It helps me sleep at night. And when I learn more about your company, that's how I felt with this. How about we talk about your background and how your journey to developing Maitri?
Yeah, absolutely. This is a funny story, and I like to tell that. My co-founder and I met probably 8 years ago at this point in Vietnam, hiking very randomly. Reconnected a couple years ago, and she is a cancer survivor. She's doing well today, but as she was going through like her last rounds of chemo, she kind of had this realization that she's probably not the only person going through some sort of medical crisis and feeling alone and like isolated and not really able to kind of communicate what it is that she's going through. And people tend to kind of like go back and kind of like shut down a little bit as they're going through this. They're less forthcoming with like information while people are around them and they kind of want to help. They don't necessarily know how. So as she was kind of like coming to an end of her treatment, she realized that this is not something that she's the only person dealing with. And a lot of the patients that she had met in like her support groups are kind of experiencing a similar thing. And she realized that there's like a lot of overhead and she wanted to fix that. So my role or kind of like my background is more in the business or like project management aspect to this. And we went through something a little bit similar, maybe a little bit different with my grandmother as she was kind of getting a little bit older. And the grandkids kind of joined together and made this like group, and we all wanted to kind of like rally and come visit and like bring things and like help and support. And it was a mess to manage because somebody picked it up and they're like, "Oh, you're gonna be here, you're gonna be there, you do this, you do that," all over the place. And I was like, I don't even know if that was the thing that she needed. Like, did they need food? Would it be more helpful if I just like showed up and like talked to her for a little bit? Did her aid need to be like relieved for a little bit? Maybe that timing doesn't work. So there was a lot that was kind of going on. So when she approached me with this idea, I was like, I get it. I get the need to kind of try to project manage your illness, I think, kind of quote unquote, where there's a lot of like people with good intentions around you that want to show up for your friends, your family, your loved ones. They don't necessarily know what to do. So they would either not do anything or do something that maybe isn't the best thing for you at the moment. And if you're going through that experience, adding the wait, I now need to send a message and like ask this, or maybe there's a calendar and there's an Excel with some things, and somebody sets up a meal train and there's 1,000 interfaces all of a sudden. And you're like, wait a second, I need to focus on something that isn't trying to figure out where this ask was being put out and like who is doing this or not. So I kind of like felt how this can make a real impact in patients' lives who are trying to do everything that they can, like in support of their care, and also in your social circles, like people around you who want to show up but don't necessarily know how. So we wanted to kind of make that a little bit easier.
Yeah. Sounds great. Sounds empowering. I feel like I heard a couple words in there, like, or at least sensed them, like, maybe patients at times feeling isolated, maybe overwhelmed. And then also I heard the word in the end there, maybe community too, whether it's a family or whether it's your larger community, like your neighbors or beyond. So I wrote down a quote, personal support companion during times of medical crisis. I think that's definitely been overlooked. And I think people do have good intentions. From that, desire or sensing a need, and kind of saw this opportunity to, she had a need. And so she's like, wow, others have been in this position. And then taking that. And so talk to us a little bit about the development of how that went through from an awesome idea and you recognizing it within your own family to making it into what it is today in a business.
Yeah. So when we spoke to cancer patients and cancer survivors, because that's kind of where we started, we realized that a lot of them did struggle with the management aspects of it, be it like having the multiple different interfaces. Some of them are just like, I don't even know where to go to. Like, I don't know what I need. So
Yeah.
what we really wanted to make sure that we included in our product was like an off the top of your head sort of suggestion list. So when we asked patients what it is that they needed help with, some of them, and they were like, oh, no, I don't even know, like I need help with everything, which is fair. And like you aren't necessarily able to kind of like very clearly communicate what it is that you need. But as we spoke to more and more people, we kind of realized that a lot of these like categories repeat. So things fall under help with the like rides to and from, like things around the house, like making sure that they understand or are able to kind of make follow-up appointments, all the way through to the companionship aspect of it, where it's just like, I want to talk to someone. Like, I don't even care to tell them what it is that I'm feeling. I just want someone to like tell me how their day was going. We built the to-do list part of it, or the shared calendar, into the app with these suggestions in mind. So if you come to kind of communicate what it is that you need with people around you, you don't have to get stuck at the I don't know, which is where a lot of people were just like, I don't know, like everything. But everything is something that's very open to interpretation. Whereas like I have a doctor's appointment Monday at 5. Can someone drive me there is very specific. And
Yeah.
that gives people around you the opportunity to look at that and say, oh, maybe I can't take you to your doctor's appointment on Monday, but I can help walk your dog while you're away, or I
Yeah.
can, I don't know, help bring food for after for you, for your family. So
Yeah.
it gave people a better understanding of what the needs really were in a more tangible or like a more concrete kind of way. And it gave the patient a way to be more clear about what it is that they need so they don't end up with 100 bouquets of flowers or like a bunch of candy or ice cream, which is really nice, but maybe not appropriate for the dietary restrictions you have now. The other part about the app that I think makes us a little bit different than other things that are out there is the way that we envision the support circles. So in addition to kind of giving you one place to manage all of those like organizational needs, we built the support circles in a way where you can kind of have them in a tiered kind of layer. So
Okay.
the people that you're very close to, you may feel comfortable asking them to accompany you to an appointment or to help you look at your test results or like schedule follow-ups. Neighbors, you might be really happy if they like help you walk your dog, but you don't necessarily want them knowing your entire treatment schedule.
Yeah.
So we created those tiers that would appear in most of the project management tools that would be outside of like the healthcare space, but
Yeah.
you would have the equivalent of like different permissions. So the patient can communicate certain things to the first circle, that would be people that you're very close to. So they would see those,
Yeah.
and some things to everyone. So it's like, I may only see the things that the patient feels close enough to share with me so that I can help in a way that doesn't feel intrusive and is
Yeah.
actually helpful.
I
So
I feel like
that's
I feel you touched on two parts about human behavior that I think maybe goes unspoken. Both the difficulty for some of us to maybe ask for help, and then also a desire in people to show up and to offer help. I think that might be something that's missing in our busy lives these days. But I'm wondering whether that was more apparent in maybe past generations or before, when maybe we didn't have cell phones, but maybe people knew their neighbors better than they do today. Maybe. So I think your product, I think Maitri touches upon that, which is really cool. So transitioning from some of the background story to the business side of things, I wanted to ask, when was Maitri first released?
so we had an alpha cohort last year. So we have 5 active cancer patients who are helping us with the very, very first version of the app. Very grateful to people in the midst of going through cancer treatments to
Yeah.
even like take time to look at something that's new. And I think if you've ever used anything that's been brand new, it doesn't necessarily work exactly the way that you expect it to. So there were a lot of times where I was like, wait, the invite didn't work correctly, or I don't know, the task set up at a different time, or like all of a sudden marked itself as done. So there are a lot of these like growing pains that they've helped us kind of identify. They've helped us reshape the way that we're looking at the calendar and the tasks and kind of like give us more insight about like what makes sense because sometimes in these more complex illnesses or like more chronic conditions, the need isn't necessarily there. The acute need isn't there every single day, but more around when the treatment is and potentially less so as you're kind of recovering from that or feeling better and potentially leading up to that. So there were trends that were easier for us to see like with their help. And that
Yeah.
took a little bit of time to kind of understand how to make that something that makes sense for the different kinds of users in the app, and it's live in the App Store, so it is available since we've added a couple of features.
Yeah.
We have an AI assistant to your point before about like having that communication and like knowing your neighbors better. Sometimes people feel more comfortable sharing when they feel the other side wouldn't judge them. So we wanted to kind of build a companion in a way to like interact with the app that is very empathetic and very kind of focused on giving information and suggestions and being kind of very receptive and helpful to the extent that like if you and I are having this conversation and I tell you, oh, like this really sucked, like this is really hard for me. And the person on the other side doesn't necessarily either feel the same or have had a similar experience, they might react in a way that you don't expect them to, and that tends to get people to shut down. So we wanted
Emotional
to
matching.
yeah, yeah, a little bit like that where you're putting things out there and the response is always, "Yes, you can tell me anything you need," and there's no kind of
Yeah.
adverse effect to that. Like, nothing you will say will scare me, or nothing you will say will
Yeah.
make me take a step back.
This is how you've trained the AI agent to be open and responsive to the patient's concerns.
Yeah,
Yeah.
absolutely. And some of it is like the actionable side of it, where if the share is, I'm like very overwhelmed, here are the things that like my doctor needs me to do, or like I'm going with her right now and I like don't even know where to get started. It can kind of help you break down those things into something that is more actionable that you could then share with
Yeah.
people in your support circle. So kind of all feeding into that, like helping the patient build a community around them as they're going through this experience that serves the needs that they have and that are helpful to them and for the people around because people genuinely want to be there for someone. They want to show up, they want to help, knowing that the thing you picked or the task that you did was something that was actually extremely helpful.
How have things been going since your launch last year?
So we have a successful partnership with Rare Patient Voices. They're an organization that gives patients paid advocacy and paid research study opportunities. So our missions were very aligned to the extent that we're giving patients a way to be more clear about what it is and communicate what it is that they need. And they're giving them like paid opportunities to do the same and give feedback about like new developments. So that's been going well, more partnerships this year to kind of help expand that. And we're also looking to work with clinicians kind of as a way to get the word out there to more patients in a place that makes sense in the duration of the treatment. Because sometimes you need some time to kind of process what it is that you've been going through and introducing this at a very early stage is too soon. Introducing this very late, like after you've completed your entire treatment, doesn't really make sense either. And I think a lot of the feedback that we've gotten is that when meeting with the social workers most of the time, but a lot of times it is the medical professional, yeah, the nurse practitioner or the doctor or whoever it is in your treatment team. They give you all these extra things that you need. So having a place to kind of put all that and make
Mhm.
sure that it's like tracked and distributed and like coordinated well could be super helpful. So that's something that we're exploring for.
Do you guys work closely, like specifically, say, with oncology or oncology providers, or maybe primary care, or is there a whole gamut of medical specialties that you work with?
So we're condition agnostic to the extent that a lot of the needs are shared between patients that have complex illnesses or like more complex medical conditions. While we did start with oncology, we're not exactly pursuing that exclusively. We have started reaching out to primary care physicians because they
Yeah.
see a lot of patients with different conditions that could benefit from the additional community support in support of the care and in support of like adherence to the treatment. Because sometimes you miss an appointment because you can't get there, or you don't take your medication on time because you can't go pick it up. It's too far.
Yeah.
So that's kind of the initial feedback that we've been getting from the PCPs we've reached out to, is that they do see that adherence to treatment is a problem. And they have seen that individuals who have stronger community support or stronger social support would be more likely to kind of stick to their treatment plan and follow through and have better results ultimately.
You're saying that Maitri helps with compliancy. It helps patients either maybe attend doctor visits or take their meds and just being compliant with their treatment plan for each person. That's huge. That's huge.
Yes. I think when you think about it, it's sometimes these treatment plans involve behavioral changes. Like you're now
Yes.
being asked to change your diet or to add more exercise. And there are people that are very self motivated and will get themselves out there and go for a 30-minute walk 3 times a week on their
And
own. But you're more likely to go if your friend goes on the walk with you, or I don't know, if you're hanging out with someone and just like chatting, or if your friend helps you find more appropriate recipes to
yeah,
like
yeah.
or if like somebody knows that and can like help you get through it, then people are more likely to kind of try and do that, as opposed to the people who struggle with like motivating themselves will gladly apply themselves with the help of someone else.
Some accountability.
Yeah,
Yeah.
absolutely. That positive accountability is easier.
What are some challenges that you've encountered? I heard one of them was I heard some growing pains and dialing the app itself, but maybe could you expand on things that you and your company have had to work through as you've progressed?
Yeah, absolutely. We started with a very direct to consumer oriented approach where we thought this was built kind of by the patients for the patients. Not exactly, but we really struggled getting to patients directly, like between where you are in your own personal health journey and where you spend your time and what kind of messaging you would trust or who you would trust to do that for you. So I think as every early stage company knows, is like you need to build that brand awareness for yourself and like show up in the right places and like clearly communicate what value it is that you bring in order for people to think that this is important enough for them to give it a shot. And I think the desire to kind of maybe transition to working with the clinician both stems from the fact that they could benefit from what the app can give patients in terms of the compliance or adherence to treatment and then the better results, like ultimately, but also being that the clinicians know where the patients are and have gone or are going through this journey with them. So that would be helpful to kind of understand exactly when to introduce this and how to introduce this. And is this something that then becomes part of the treatment plan in a more kind of cohesive way, as opposed to something that just kind of showed up organically throughout the journey. So I think that's what we've been trying to like dial down, and that's where this new direction is coming from.
Yeah. Illness can be obviously challenging, and I'm not sure people are clicking on social media about unless you're in those shoes. I'm not sure people are clicking on things. So how do you guys market? How do you guys get the word out there about Maitri?
Yeah, so this is exactly hitting the nail on the head. I think the direct to consumer, like social media approach was something that is not in our wheelhouse per se. Like this is not in our kind of skill set or experience. The partnership was an attempt to do that because our partners do have that more extensive social network. So we were hoping we can kind of like expand or amplify our voice through that mutual partnership. And I think now it's more looking at who the right clinicians or the right professionals would be who see the value in the product and would be willing to kind of work with us on a longer term pilot and see how this actually affected people and adherence to treatment and ultimately the results. So I think that's kind of what we're going after at the moment. And it started with me going door to door and like knocking on doors at clinics, giving them
Nice.
my business card and
Yeah.
leaving a little one pager. And I was like, I'd love to talk to you about what this is. And we had some initial conversations with PCPs that came that way. A little awkward for me, but not for them because
No,
apparently
I'm sure
pharma
that
reps
yeah.
do this all the time.
So is your market? or I don't know if it's still being if clarified as each day, but is it your business to business versus business to
Yeah, yeah. I think it would be more B2B, 2C even, because
yeah,
ultimately the user would still be the patient. They're the
yeah.
person who needs to build that community around them and to more clearly articulate what it is that they need. But if we're looking at this in terms of like a distribution channel, then we're definitely looking at those partnerships with the clinicians or the clinics and potentially like hospitals and someday like insurance companies to kind of say, oh, we have people we know are going through something that would require a lot more support. And this is a way to offer that kind of support, similar to the way that some insurance companies offer dedicated apps to women who are pregnant or postpartum to speak to a nurse practitioner or to speak
Yeah.
to their physician. So to kind of like have that immediate, like, so this could be another tool that they offer in support of the care.
I would think a reasonable place to explore, and I would think the catch would be that this could probably decrease medical costs. You know, if people are compliant, if people are feeling supported by friends and family, doing all those things, making appointments, taking meds as directed, and so on and so forth, maybe that can expedite recovery. And yeah, I would think that if you could decrease their costs, I think you would catch their ear. What are the goals for Maitri, say the next 6 to 12 months? Where do you guys want to be?
We want to end up being like the go-to for people who are going through complex illnesses or serious illness, be introduced kind of at that like earlier stage and help them build that support system to help them as they go through their journey. We want to be in more clinics and basically on more phones, I feel. So yeah, won't say no to landing a big hospital partnership, but I mean, if that's a year out, then that's okay too.
Is your reach right now, is it in your region specifically, or how far across the United States, or how far of a reach have you guys, how have you grown?
So it's open. When we first started, we were more focused locally, usually here, but it's open across the US. Like the app is available. You don't need the people you invite to be in your immediate surroundings. Like some of
Okay.
the things we've seen is that people just want to have a conversation. It's like call me on the phone is a
Yeah.
very easy request for you to do, even if I'm on the East Coast and you're on the West Coast, or if
Yeah.
you're not even in the country. So there are no strictly like local limitations to this, and you're free to kind of invite whoever you deem close enough to share things with and the way people contribute, because a lot of it is that like back and forth. If I ask you to walk my dog, it doesn't make any sense if you're on the West Coast. Like you wouldn't fly here to walk my dog for 30 minutes and come back. But there are definitely more of the companionship and like community aspects of it that are still like, I just wanted someone to check in on me, or like some of the things that could be done virtually or remotely, like going through scheduling appointments, going through lists, like helping do other things can easily be done nationwide.
So someone doesn't have to say I were the patient, I had a concerning situation. It doesn't have to be limited to my social network. Like I live in a rural area, I could, if it made sense, like if I wanted a conversation, it doesn't have to be in your, like, could someone just sign up for, or post a need or request, and then if someone else were available, like it doesn't have to be my immediate, when I say immediate, I don't mean my household. I mean like maybe people I don't know could contribute to my recovery plan.
So what we understood when we spoke to patients was that a lot of them are apprehensive of sharing more personal things with individuals that they don't know. And there's a lot of nonprofits and other organizations that have volunteers, and they can kind of offer that as like a supplementary service. For us, it's more about helping you curate your personal support system versus tapping into an existing resource of individuals who are willing to offer their time or skills or ability. So it's not discoverable. And this was feedback that we've gotten early on that kept like coming up. It's like you can't, it's discreet enough for you to decide who you
Yeah.
want to invite to it versus like no one's gonna stumble on it and be like, oh, you're using that. So that means one, two, three, four. And we have heard that from some patients where like somebody saw it because they were on this network for someone else, and I was like, "I didn't want anyone to know that this is something that I'm going through," but the product or the network that they were on wasn't set up to have that privacy. So we really kind of took care to make sure that people, while you can send an invite link in a group, and that's absolutely fine, you don't need to send individual invites. This is less of a, here are volunteers in your area that are willing to do something and you can make an ask of that. And I think that's one area of like partnership that we've been considering because we know some nonprofits or some other organizations do have that and they don't necessarily know of all the asks. So we can give them a version of the app to help organize support to the individuals that they support through their volunteers to kind of augment this. This would be like a fourth circle kind of thing. But at the moment we're kind of, we started out with helping people expand on their own social network. And I think if you think of, do you know the 6 degrees of separation concept? Yeah. So it's like you have more people in your network than you think.
Yeah.
And I think once you start kind of expanding that, you're like, oh, wait a second, actually, there is more.
Yeah.
So
Very cool. Thanks so much for speaking with me today, Yaara. I'm really impressed by the work that you're doing. Sounds like you guys are really making a difference and pretty awesome stuff. Keep it up.
awesome. Thanks, Phil. Appreciate it.
You're welcome. Anything maybe I didn't touch upon that you want to share with the audience, or anything that you're particularly proud of about Maitri that maybe we should emphasize?
I just share an anecdote, I think, on the way that we're able to kind of like help people feel more connected with themselves and their environment. One of our first users in our like alpha cohort asked for a hug. She like put that out there as a task, and then her mom drove out to meet her and gave her hugs. So we always feel like this is a very good kind of like way to explain that help doesn't necessarily need to be a meal train, and it's not always monetary. Sometimes it's just showing up, and there's a better way to do that. So I can end on a high note, I think.
Thanks. I love that. Thank you so much, Yaara, for taking some time to meet with me and to share your story with our audience. Really appreciate it. Where can people go to learn more? We'll put some links underneath, but let's just say it. Where can people go to learn more about Maitri?
Yeah, so you can check out our website, matrihelp.com, and our app is available on both app stores. So feel free to download, check it out. If anyone has any other questions or want to give me any specific feedback, please reach out to me directly. Always happy to have more conversations around this. Any clinicians out there who are looking to partner, please hit me up.
Okay. All right. Well, thanks so much, Yaara. Appreciate it. And best of luck to you and Maitri in the coming year.
Thanks, Phil. Appreciate it.
Thanks for hanging out with us, and stay tuned for our next episode from the HealthCast. Appreciate it, guys.